Actually, CDISC is an organization who is actually designing the standards. CDISC is nothing but it is actually an organization who is actually designing the standards in the clinical trial. So different standards are there. In that, we have the first type of standard is nothing but SDTM, study data tabulation model, and we have ADAM, analysis data model, right? All these actually standards are designed by an organization whose name is what here? CDISC. Understood? So CDISC is the organization which is actually designing the standards for the clinical trial. Understood? So these organization is actually you have the website here. You can access the this organization website is also there. There you can download the standards freely. The SDTM and ADAM guides are there, right? And one more define is also there. These are actually available on the cdisc.org, right? Is the organization. So what is the full form of CDISC here? Clinical Data Interchange Standards Consortium. So this is actually the name of the full form of the CDISC. CDISC, just so I told you the organization, right? The full form is what here? Clinical Data Interchange Standards Consortium, which is designing the standards here. One committee, we have a team who are making these standards known as Submission Data Standard Team. So they are actually making these standards for the clinical trials, right? So in that, we are going to see the first type of standards which are used in the clinical trial. See, why we are using this now, the question arises, what is the role of this? See, already we have seen the data analysis in SAS, right? Already we have seen how to make the tables, how to make, reports in the SAS, right? How to make the charts, graphs, the other frequency reports and other analysis report we have seen. We have seen in the SAS in detail. Again, why we want to use the CDISC? See, because the FDA, they want the data to be submitted in a particular format. So that format is actually given, the protocol is given by the FDA. So as per that protocol, as per that format, only the data has to be submitted. See, everyone in their own format, they cannot submit the data to the FDA because the FDA is going to store this data on their servers, on their database, right, for future reference. So they have a particular format. They have some standards. So that has to be followed. These standards are actually the protocol. So in that only the data has to be submitted by the research organizations. That standards has been designed by the CDISC organization. So that standards are designed by the CDISC organization. So in that standard, we have the first is SDTM, study data tabulation model, and other we have the ADAM also, analysis data model. We will see one by one. So now we are going to start the SDTM, study data tabulation model is the full form of SDTM. Understood? Study data tabulation model. And SDTM-Hyd, study data tabulation model implementation guide. SDTM-Hyd means what here? Study data tabulation model implementation guide is there that you can download from the CDISC organization. That I will provide this document, right? Don't worry. And the CDISC is actual, the SDTM is present. SDTM guides are present in the form of different versions. So we have like SDTM 3.2, 3.3, 3.4. So like different versions are there, right? Different versions are there. So latest version is 3.4, right? So updated again 3.4 is there. We have to check the new versions every time. So new versions, right? Are there, right? New versions are there. That will be, there. But I am using the 3.2 version. You can ask me why I am using 3.2 version, still 3.4, 3.5, because this is the basic version where all the basics are given, right, in detail. In the updated version, they have given the updates. The basics they haven't explained thoroughly. So better why I'm using 3.2 SDTM 3.2 version, because in this actually very clearly they explain the concept. The concept is very clearly explained, whereas the 3.3, 3.4 is also there. So the language is little different, right? In the 3.4, they have some updates. Some new tables are added in that 3.4, right? So that we will see later. But I am using 3.2. Why? Because it is the simple language is there. Very easy for a new person to understand the concept, right? So SDTM 3.2. Anyhow, so now we are going to see here So study data tabulation model, right? Implementation guide. So in this the SDTM, right? So basically see the what for SDTM is designed. Now we have the different standards I told you. One is SDTM, study data tabulation model. Other is ADAM, right? So in the SDTM, what we are going to see basically in SDTM. My question is that what we are going to see in SDTM. See, SDTM is actually giving the standards regarding the clinical trial data sets. Understood? How the clinical trial data sets, right? In what format, what structure of the clinical trial data set should be there, right? What should be the format of the clinical data set that is going to be submitted to FDA. Understood? What about the ADAM then? See, ADAM is dealing with the analysis data sets only. ADAM is dealing with the analysis data set. Now, what is the clinical trial data set? The clinical trial data set means the original data which we are collecting on CRF. CRF is nothing but the case report form. So that data is actually converted into SDTM domains, SDTM tables. Understood? The format which we are going to now, the first SDTM we are going to use now. First, we are using the SDTM study data tabulation model. Here, what directly the clinical trial data which is collected on the CRF, it is going to be converted into SDTM domains. Are you understanding the point? Whatever the clinical trial data is there, which we collected on the CRF, we have seen already the CRF, right? So that data is actually standardized. That data is standardized, right, into tables. Into tables that is known as SDTM domains. What do you call that tables? SDTM domains. So here now from now onwards, the term table I will not be going to use. I will be using the term domain. See, just remember the term domain means table only. It's alias, it's other name given for the table. So we are not going to use the term table now. From now onwards, we are going to use the term domain. So don't confuse. Domain means what? Domain is nothing but the table only. Understood? So domain is nothing but table. See, any version you can download all these 3.3, 3.2, 3.4. I will give the 3.2, 3.4 both. Both I will give the, don't worry, right? I will give the both the guides. You can refer all the guides. There is a little difference, right? Don't worry the versions. See, the updates, whatever they are making, they are giving in the new version. Understood? Whatever the new tables they are adding, that will be actually given in the new version. That is the only difference. There is no much difference in each version, right? So anyhow, so now I was telling about the SDTM tables are called as domains, and each table has, right? For example, the horizontal rows and vertical columns. Listen carefully. Each table has horizontal rows and vertical columns. The vertical columns are known as variables. The vertical columns are known as variables, and the horizontal, listen carefully, right? Remember all these terms. The horizontal, right? Sorry, the horizontal rows and vertical columns. The vertical columns are known as variables. Understood? The vertical columns are known as variables, and the horizontal rows are known as records. Understood? The horizontal rows are known as records. So here the two terms are there. Vertical column in the table is known as variable, and the horizontal rows are known as records. Understood? So now, see, each row will give the record of a patient. One row, for example, horizontal row means like this, vertical means like this, right? So vertical column will give the different variables, right? And the horizontal row will give the record of a patient, the complete record of a patient. Are you getting me? Now, we will see the variable term. The variables I told you just now is the vertical column. Vertical column is nothing but the variables. See, these variables are basically divided into 5 categories. The variables are divided into basically 5 categories. 5 types of variables are there. What are the 5 types of variables here? Identifier variables, first type. Second is the topic variables. Third is the timing variables, right? And fourth is the qualifier variables. And fifth is the rule variables. So whole SDTM variables, see the vertical column, there are so many variables are there, but they are basically classified into 5 types. ID variables or identifier variables, topic variable, timing variable, qualifier variable, and rule variables. So we will see one by one what are these variables, right? So first is nothing but we have the ID variables. See, ID variables are nothing but this is for identifying the study or subject or domain. Understood? These are used to identify. These are used to identify, right, the study, subjects or domain. For example, I will give a simple example, like you are having a college ID. You have a roll number, right? For example, if you are studying in some college, for example, or you are working in a company, you have, for example, employee or employee ID is also there. If you are studying in a college, you have a roll number or college ID, right? So everything that college ID or roll number is the identification of that student. If you want to identify the student, so directly if you put the roll number of that student, you will get the full detail of that student. So that is actually the identifier variables are used as a to identify the subject or study or any domain. We are giving a ID, understood? So this is known as identifier variables. So this is actually specific. Every ID is actually unique. Unique ID is there, right? So it is a sequence of alphanumeric character, right? Whatever the ID will be a alphanumeric character. So it's a number and alphabets combined, right? That will be identifying a particular subject or study. Now, next, what we have here, topic variable. See, topic variable is actually mainly the focus of the domain. Mainly, the focus of the domain is on the what? Topic variable. See, for example, what is the meaning of focus? See, for example, for each table, we have a main focus. Main focus means we are talking about what? In the table, what is the topic? What is the topic means? Mainly we are discussing about what topic, right? In the domain, that is nothing but the topic variable. For example, in demography, we have the subject ID is the topic variable. So we are discussing about subject in the demography. We are discussing about the subject details in the demography. That's why the subject ID will be the topic variable. The main topic on which we are discussing, the subject ID. So the main thing is the subject ID. That subject ID will be called as the topic variable. For example, if we take again the vitals, for example, domain is there, right? Vitals domain. Vitals means what here? We are doing this is something like we are collecting the information like blood pressure, something like that, right? So we are performing the test. Yes or no? See, to collect the vitals, we are performing a test like blood pressure, height measurement, weight measurement. We are performing some test. So test is CD is the topic variable because this vital domain is dealing with what? Different test. Different tests we are actually discussing in the vital domain. So test is CD will be the topic variable because the main focus is the test or test is CD. So such variable are known as what? Topic variable, which is the main focus of the domain. Understood? Next is what here we have the timing variables. So timing variables are nothing but in the trial, for example, we have the start date, end date, right? When, for example, let us take example of adverse event domain, right? In adverse event domain, we have the start of the adverse event, onset of the adverse event, and when the adverse event has been resolved. So start date and end date. So all these dates are coming under what? Timing variables. Are you getting me? All these dates are coming under what? Timing variables. Everyone clear? So every date, whatever the dates we are putting, right, in the domain, the dates will come under timing variables. So next is what here? Qualifier variables. See, qualifier variables are nothing but here, they are actually, again, they are not one type, there are 5 types of qualifier variables are there. The qualifier variables is actually the class where we are not having the one type, we have the 5 types of qualifiers are there. How many types of qualifier variables are there? Again, we have 5 types. We will discuss now, right? So 5 types of qualifier variables are there. What are they? See, we have the grouping qualifiers. What is the meaning of the qualifier variable? First of all, see, the meaning of the qualifier variable is nothing but it is giving the additional information. It is giving the additional information to describe the results or observation. Understood? It is giving some extra information. For example, I will tell you, see, in the, for example, just now I told you about the demography. See, in the demography, for example, we are talking about subject. Subject means the people who are participating in the trial is known as subject here, right? So we are discussing about the subjects. So these subject extra information is what? See, for example, the subject ID is there. Subject ID is what? Identification number. But what is the additional information? See, the name of the subject. For example, the name of the subject is the additional information, right? Like, for example, his address is there. It is also additional information, for example, right? The race of that person, right? So all these are nothing but are known as qualifier. Understood? So qualifier variables means, see, by knowing the qualifier variable, you can describe the person in detail. See, only giving the subject ID is not enough. Yes or no? See, for example, I will tell you one person is there. One person is there, for example, right? So that person is actually, one person is there, one person, only ID I'm telling. So you will not get the full information of the person. If you want to get the full information of the person, I have to tell the ID also. I have to tell the name of that person also. I have to tell the age of that person also. I have to tell the other details like sex of that person, whether it's a male and female. Then only you will get the full information. That additional traits or additional information, whatever you are giving, is nothing but qualifier variables. Now you understood? See, name, sex, all these are coming under qualifier variables. Are you getting me? So whatever the extra information, the name, sex, age, everything are coming under what? Qualifier variables. Additional information describing a person or record or anything, right? Now in that qualifier variable, how many type I told you just now? There are 5 types here. So just I will discuss one type, then I will stop. The time is, it's a scheduled class, right? So it will disconnect automatically after three and a half minutes, right? Just I will start the qualifier variable. Tomorrow we'll discuss in detail, right? So 5 qualifier variables are there, 5 subclasses are there in this. In the first type, we have the grouping qualifier. Grouping qualifiers are there. Grouping qualifiers are used to group the data into categories and subcategory. Grouping qualifiers are used to group the data into category and subcategory. For example, I will tell you, see, age is there. So age, what I am doing, for example, age I am making into groups. For example, I am having in the trial different people of different ages there. For example, I have the age of the participants ranging from 18 to 65. So I am making the groups. See, 18 to, for example, I am just making that 18 to 30, for example, 18 to 25. Okay, 18 to 25 one group, 25 to 35 one group, 35 to 45 one group, 45 to 65 one group. So I am making the different groups. Understood? So this categorization, right, is nothing but the grouping qualifier. I have given just example. This is not exactly, just example I have given here. So you are making the groups. So that actually making that groups is nothing but the categorization. The categories and subcategories. And in case of, for example, if you talk about this one, medication, if you just talk about the medication, how we can give the example of categorization medication. For example, one drug is there. So one drug comes under, for example, I am using anti-hypertensive drug. I am just naming a drug as a atenolol. Atenolol is a drug which is used for beta blocker. It's a beta blocker which is used to reduce the hypertension in patient. So it is coming under main category as anti-hypertensive. It is coming under the category as anti-hypertensive. Again, in anti-hypertensive, we have so many types of anti-hypertensive, like subcategories. What are subcategories of anti-hypertensive? Beta blockers, calcium channel blockers, ACE inhibitors. These are different types of subclasses in the anti-hypertensive. That is known as subcategory. So main category of the drug is what? Anti-hypertensive. Subcategory of the drug is what? For example, beta blocker. In that subcategory, the name of the drug is what? Atenolol. Now you understood how we are grouping the information? So this is nothing but the grouping qualifier which is used to group the information. So we will discuss the other qualifiers, right, tomorrow in detail.